Medical professionals. What are some of the most mundane reasons most people are unaware of that make them sick? Story 1. Okay, so this is not related to sickness but injury. After a certain age different for everyone, you should get rid of every slippery pair of socks, uneven area rug, or any other tripping hazard in your house. It's very easy to trip and fall in the dark trying to get to the bathroom, and a lot of people have major complications trying to recover from a broken hip or other leg injury. Small trip hazards in your house may not seem like a big deal, but they could lead to an injury that you never recover from, and it's a very common problem. Story 2. I've had so many male patients with rectal problems because they will not wipe after using the bathroom. One guy told me it's gay to touch your butt, another said he just don't do that wipe thing, another said he didn't care, totally preventable disease state. Story 3. If your toes start turning black from untreated diabetes, it's not going to get better on its own, it will only continue to get worse, and lead to irreparable damage including the loss of the foot entirely. If people also realize that aspirating things something going down the wrong tube as most people say causes pneumonia. Also if this counts, but I can say that after multiple months doing X-ray at an inner city level 1 trauma hospital, I will never ever get on a motorcycle, four-wheeler, ATV, dirt bike, none of that. Nope, no thanks, I'm good. Story 4. Finishing antibiotics. Always finish the full course you are prescribed. You think you are better, but the bacteria may not be dead and it's gonna come back stronger. Story 5. 1. Drinking. Cirrhosis is very mean. 2. Wash your hands. I don't mean a little squirt of soap and then immediately rinse it off, I mean the whole 20 seconds. Neurosapovirus, C. diff. Trust me, you don't want it. Story 6. Untreated sleep apnea is absolutely terrible for you. Over time it can lead to heart problems, diabetes, stroke, and even shorten your lifespan, to say nothing of what chronic lack of quality sleep can do for your immediate mental and psychological health. Snoring all night every night is not normal. Get over yourself and use the CPAP. Story 7. Derm PA here. Please moisturize your skin. Wearing lotion is not only a girly thing to do. Dry skin can lead to itchy skin, which can lead to chronically itchy skin, which can lead to intense scratching and can leave open wounds and sores. Itchy skin can drive a person bonkers. I see it every day. The easiest way to prevent this is to wear lotion. Story 8. Not following advice like reduce or cut out something in your diet or not exercising. Also, not keeping basic hygiene practices like washing your hands. Story 9. I work at a dentist. People improperly taking or prematurely stopping antibiotics. When people start but don't finish antibiotics, usually because they feel better, the surviving infection grows resistant to those antibiotics, so future courses become inefficient or don't work at all. Take the whole course. Infections in your teeth and jaw have a short path to your brain, and leaving that infection untreated, especially if it's asymptomatic or not causing pain, can cause bone loss, which can very much detrimentally impact things like implants and even your jaw strength. Story 10. Vaping. I have PTS that repeatedly see allergists pulmonary BC. They don't know why I'm wheezy all the time and it feels like I can't breathe. Nasal sprays, antihistamines, allergy pills, 3 to 4 different Nebsol while denying they vape. It's gross. Story 11. Do not let your dog lick an open wound. Their mouth is full of bacteria. They don't have clean mouths like we were told when we were kids. Also, please take your meds before coming to the hospital. Just let us know what you took. No reason to skip your BP meds. Bathroom injuries, y'all. I cannot tell you how many people come to the ER because they vasovagaled on the toilet pushing too hard. Also make sure your toys have flared bases. D. Story 12. Pay attention when something changes or something new happens. Even minor issues that don't go away or continue to get worse should always warrant a trip to the doctor. I'm a medical student and I put off going to the doctor for embarrassing urinary symptoms for 6 months. I finally saw someone a couple weeks ago and they think I may have MS. I'm so mad at myself that, if I do have MS, I could have started treatment months ago and prevented ongoing nervous system damage. Story 13. Not drinking water. So many people feel like but only drink coffee, Coke and Corona. People like this live on a on-off edge of minor dehydration where the tiniest bit of exertion feels impossible. If you actually drink the water your body needs, it fixes all sorts of minor issues. Story 14. Swimming with contacts in. Every time I dispense fortified vancomycin and gentamicin compounded by our 4-room, strong antibiotic eye drops. In the chart it turns out that the patient was swimming with contacts in. They get super nasty infections. Story 15. This is good advice. I'm 43 years old and I tripped over an uneven sidewalk a few weeks ago and I'm still dealing with some pains from it. I never realized just how dangerous falls could be, especially for the elderly before. Story 16. Not a doctor. My mother kept getting itchy eyes, scratchy throat. Mom, you're drinking stevia, you have a ragweed allergy, stop drinking that. She stopped and it was that. It keeps happening periodically. Mom, echinacea, stop taking that. You're making yourself sick. Mom, did you look at the label? This says stevia, MAMW. Story 17. Not necessarily sick, but long car rides without brakes can absolutely cause blood clots, which can possibly lead to a pulmonary embolism if left untreated. Story 18. If you have sudden unexplained weight loss, please go get checked out. I cannot begin to count how many people, especially middle-aged and older, I've triaged for some other symptoms. Drop a random oh yeah, and I've lost XX amount of lbs in a month, and more often than not it turns out to be cancer. You're not turning into a skinny legend, it's cachexia. Story 19. Listening to influencers who are not medically trained. I've watched ads on TikTok where an influencer will pour 2 packs of liquid 4 into a cup to make a new flavor, or whatever the raw milk and unpasteurized nonsense is. You can't lemon and cayenne water your way out of hyperlipidemia, but you can erode your gastric lining. Story 20. Consistently getting less than 7 hours of sleep, even if it's 5 hours, is enough to suppress your immune system. This is because deep sleep is extremely important for T-cell function, the cells that seek out and destroy infected cells and cancer. Chronic short sleep leads to more frequent infections, and it also takes longer to recover. Story 21. Brush your teeth. If you have a stomach bug or anything else that causes vomiting and diarrhea, try to keep up with fluids, crackers or plain toast if you can, but especially water. You lose a lot more water through vomiting or diarrhea than you'd think. Broth, soup and tea are great ways to rehydrate your body. This goes doubly for children, people with illnesses and the elderly. Check your testicles regularly for knots and lumps. If you are concerned, check with your GP. Anybody can get breast cancer. Same goes for moles. Any change in size, shape or sudden discharge, get that checked out, and not just white folks. Anybody can get skin cancer. No matter the amount of melanin in your skin, animal bites and scratches should at least rinsed under clean water. Better yet, apply disinfectant. If the area around it becomes redworm swollen, go to urgent care. You don't want to lose a hand to a cat scratch. Try to have some sort of sleep schedule and get around 7 to 8 hours of continuous sleep. Your future self will thank you. Story 22. Not a medical professional, but so far there's been 3 entirely unrelated people in my life who have casually gone pants on head crazy and then found out they had black mold in their homes. For the love of God, if you start noticing somebody's lost the plot, lovingly convince them to do black mold testing. If it's not that, their thyroid may have gathered its little coat and hat and suitcase and headed out the door. Story 23. Just because the health condition is common in your family, doesn't make it normal to have that condition. E.g., young woman from a family all living with type 2 diabetes, gets diagnosed with gestational diabetes and pretty much ignores it because it's normal in her family. She's told over and over to monitor her BGLs and keep them under X level with the insulin etc. she's been prescribed, as high sugars are not only harmful to her but also to her fetus. Lots of education given on all of this and specifically told that her baby could die if she's not vigilant, still does her own thing and to no one's surprise stillbirth. So senseless and avoidable. Story 24. Don't put off seeing a DR for a new concern. Had a point utilized their health insurance really well, managed to dodge several cancers from going berserk and only traded it for a few scars on their skin. Pretty amazing when you can catch stuff early and only need a surgery with no chemo. Had many others put off stuff that killed them or will be their demise soon. Probably could have had a good 10 years before leaving spaceship Earth, but alas, anxiety fear can get the better of us. Story 25. Chronic reflux can cause cancer. Chronic throat clearing isn't normal. ESP after eating. Snoring doesn't. Sleep apnea. It means you may stop breathing for periods when you sleep, which can cause heart enlargement, high blood pressure, clotting, stroke, the list goes on. Where the CPAP, if your blood pressure is normal, it doesn't mean stop taking the BP meds. It means they are working. A super high blood pressure isn't just BC, you're stressed, anxious in the moment. That's probably happening all the time off the monitor, and it isn't good. A single EKG or a week-long Holter monitor that doesn't show atrial fibrillation doesn't mean you don't have it. Maybe it just didn't catch it during that period. These are just a few off the top. Story 26. Not a professional, but a med pleb. Diet plays a huge factor in overall health, both short and long term, especially for those that are lactose intolerant and choose to ignore our BODA signs of displeasure. Story 27. I had a type 1 diabetic patient in medical school who stopped taking her insulin because it would help her lose weight quickly. Her chronic high blood sugars instead shut her kidneys down and blinded her in one eye. Story 28. I'm in public health and work closely with our medical director. One of the top stupid reasons people get sick is because they don't fully and frequently wash their hands. Story 29. You are the important piece of your healthcare team. They cannot do it without you. Please be an active participant. It improves your overall health. Take the entire antibiotic prescription. Do the PT. Do the homework PT gives you. Wash your hands. Wash your hands. Don't touch your face or open wounds without washing your hands. It's okay to use assistive device. Bonus: bring a second person to take notes or ask assigned questions if you feel overwhelmed or like it made sense at the time, but no longer does when you get to the car. Bring a reliable note taker, and bring reminders that you will understand when stressed. Story 30. Physician 1, alcohol 2, obesity 3, indiscriminate over-the-counter supplement use 4, motor. Story 31. Patients cutting their toenails wrong. Many people think that if they have a slightly ingrown toenail, that they should try to cut out the ingrown portion by clipping them at a sharp angle curve at the corners, when really that just makes it much worse. They should clip the nail straight across instead. Story 32. Stop changing your medications on your own. Please know, the vast majority of the time, you're just screwing yourself over. A small minority of the time, you're putting yourself at serious risk of a devastating medical event. Just don't, for your own sake. Story 33. Hand hygiene. The amount of people I've seen that just walk out of a public bathroom without washing their hands is beyond me. We touch public surfaces all day long. At least put some dang germs on your hands. Story 34. Physician, diabetes man. It's such a difficult disease to manage for anyone, but particularly when it afflicts lower socioeconomic status. Asking anyone to check their blood sugars 5x a day manage multiple medications, take insulin, follow up with their physician every 3 months is difficult. Way worse when you don't have access to your medications, can't afford your medications, don't know what your medications do. On top of that, most people don't feel their high blood sugars, so surely diabetes isn't causing it. Leads to severe renal disease, blindness, diabetic foot ulcers. Many people I see need amputations, severe neuropathy. But it's hard, and when life is hard on you, it makes diabetes even harder on you. I wish I could say obesity because in my area of the United States, it affects dang near everyone. And it leads to so many untreated issues including obstructive sleep apnea leading to heart failure, obesity hypoventilation syndrome, pulmonary hypertension, metabolic syndromes, and even worse, inability to take care of yourself because you're so obese. Think wounds that you are never able to clean. But no one wants to take accountability for their weight even when it does cause problems. Story 35. Hand hygiene, sleep hygiene, and don't share clothing, textiles, materials with people you don't know. I work in a jail and once had an entire unit get pink eye. When I asked if they shared anything, someone said when they work out they all shared one towel to wipe away their sweat. He was horrified and grossed when I explained how pink eye get transmitted through. Story 36. Food. Society does not understand food and what absolute we are sold to put in our bodies. Instead of being educated about it, we just accept chronic illness and pharmaceuticals as the norm. Story 37. Ringing in your ears. Not always an elderly thing and not always from lack of ear protection. Intracranial hypertension could be at play, but also, wear that ear protection. Story 38. Not washing your hands. That is the single most effective way to prevent the spread of infection. Before you eat, after using the bathroom, after going to the store, after touching things outside, before touching a baby, after touching a baby, after you come home from shopping, after playing outside, after taking out the trash, unsure, wash your hands. Story 39. I recently had an unexpected fall for the oddest reason. I was having a bad reaction to the statin I take every day and one foot went entirely numb. I was trying to walk to the other room, but when I set my foot down, I couldn't feel where it was and just fell over forwards. Luckily I wasn't injured, but it was scary. I quit the statin. Story 40. Either I stopped going to PT because it was uncomfortable. No dude. That's almost the point, or my therapist asked me too many questions, literally had someone transfer for me, and this was their stated reason why. Take the cake. Story 41. Not sleeping enough. Sleep is so important, and as a nurse as well as a patient with sleep issues, sleep deprivation can really screw with you in many different ways. Story 42. Taking too much over-the-counter medication. Taking more ibuprofen doesn't make the pain go away quicker. It kinda just destroys your kidneys over time. Dialysis is a life-changing, expensive of a treatment. You don't want it. If you find that you need to take ibuprofen consistently for 2 weeks, you need to see a doctor because ibuprofen isn't helping anymore and something could be wrong. As for Tylenol, it's the most commonly overdosed medication. Tylenol breaks down into a byproduct that is toxic to your liver. This byproduct builds up when you take more than the prescribed dose, and this byproduct takes a long time to go away after it forms, meaning more liver damage. But wait, there's more. Unless you've been prescribed to do so by a doctor, you shouldn't need Nexium prilosecamepryl for more than a 2-week course. If your symptoms are still there after that, your doc should at least check you out and determine what is causing your heartburn symptoms. Story 43. I could go to a doctor with an axe in my head and the first things he would tell me are don't smoke, exercise more, eat healthier. What's often overlooked is sleep more, work less. Story 44. Severe heart problems perpetuated by poor oral hygiene. Not brushing your teeth can cause pericarditis by allowing bacteria from the mouth to enter the bloodstream. This is not a common occurrence, but it happens. Story 45. We are seeing a higher number of NAFLD, non-alcoholic fatty liver disease, due to people eating their way to their graves through too much sugar, fat and calories in general. What people don't realize is that unmanaged NAFLD can cause serious liver damage like cirrhosis and eventually death. Story 46. Sometimes a patient will have been on the unit for 3 days and I haven't seen them take a sip of water the entire time I've known them, and then they don't feel good. Please, for the love of God, just drink some water. Story 47. Long-term, low-grade stress. Everyone focuses on large stress or stromosec, and while yes, those are bad, being consistently stressed over a long period of time is worse. The epigenetic changes alone can be horrific, not even including the direct health concerns. Registered social worker, as well as forensic psych neuroscience student. Story 48. Smoking weed and cannabis hyperemesis syndrome. Especially when they are smoking multiple bowls per day, folks will insist that their nausea can't be related to the cannabis, but then they magically get better if they can significantly cut back. Story 49. Not using available safety equipment. Not buckling seatbelts is probably number one. It's so easy. They're literally in every new car sold since 1968, but so many people are getting thrown around and ejected from Cratchits that they could have walked away from if they were belted in. Because I work in the USA, unsecured firearms and firearms easily accessible to persons under the influence is probably number 2. The number of people I've taken care of whose gun accidentally went off when they were cleaning it is absurd. The number of people I've taken care of that were shot while they and or the shooter were intoxicated is horrifying. Story 50. Most causes are mundane, TBH. Diets that are just a little short of nutrients, accumulating over a long time, just a little too little sleep slowly draining you, time since your last workout is a little too long. The air quality in your neighborhood is just a little polluted. Small issues add up over years and decades to eventually mess you up, and that's the insidious part, because it's so slow, you don't notice until you compare yourself to someone else, because you don't suddenly develop bronchitis. It's a decade of living next to a busy, dusty highway that slowly irritates your kids' more sensitive lungs. Story 51. Tick bites. They are tough little suckers and you need to remove the entire thing. Make sure the head is gone. If you develop a bullseye rash, you will need antibiotics for ages. Story 52. Both. LOL. If you require a Z-Pack, get it, and finish the recommended dosage within its prescribed intervals. If you don't require one, however, don't take one. A nuke like a Z-Pack is meant to wipe the slate clean later to rebuild the gut and immune system slowly with diet and exposure. Story 53. Lack of proper hydration. People need to drink more water. Don't use additives such as Crystal Light, Mio, etc. Flavor water naturally with mint, lime, ginger, fresh fruit of your choice. Drink at least 8 glasses daily. Your kidneys will thank you. Story 54. Sedentary lifestyle. Sitting all day at a desk, sitting in front of the TV all day, sitting in bed, not moving your body enough, all lead to musculoskeletal problems, heart problems, and decreased longevity later in life. Story 55. 3 billion people have iron deficiency. For the most part, if you eat meat, you live in a wealthy country, and you're a man, you should be good. But even then, I'm all of those things and was still deficient. Anyone else has a decently high probability of being iron deficient. Get tested. Recent scholarship suggests that ferritin level should be kept above 100, because that's the level at which no one can be deficient. I was deficient at 72. The standard rule is 30. Story 56. Not getting enough sleep. And just because you've getting by on 6 hours of sleep for years and I manage fine doesn't mean the lack of sleep isn't impacting your health. Story 57. Reusing a contaminated disposable toothbrush after being treated for thrush. Repeatedly, they were concerned about the cost of the toothbrush. Reusing a toy without cleaning it after being treated for bacterial vaginosis. Over, and over, and over again, they got treated 6 times in 18 months. Story 58. Marijuana can make you episodically uncontrollably. It's called cyclical vomiting syndrome. It's real. It typically happens in heavy users, and can happen after a long time using, and it doesn't happen to all users, just a subset, and it doesn't seem to immediately correspond to use. Don't get me wrong, it's easier to take care of somebody who likes special brownies occasionally than somebody with an alcohol problem or, God forbid, harder drugs, but part of the issue treating this particular problem is there's usually a lot of emotional baggage attached. People don't want to believe marijuana can do anything bad to them. They want to believe their healthcare team are squares blaming reefer madness. It's such a part of their lifestyle and identify they can't imagine living without it. I've seen somebody die because they went into a fatal arrhythmia from electrolytes getting all messed up because they were barfing so much. And I've also heard of bad stuff happening like tearing your esophagus from barfing really hard. If it happens once, you're probably fine. Just stop. If you have this problem for a long time, bad stuff can happen. So please, if you are having inexplicable episodes of yarfing and Mary Jane is in your life, try going without her for a while and see if it gets better. Estimates vary about when you should see improvement, but hypothetically I wouldn't say quitting made no difference until at least a month had passed. I swear we're not just making stuff up. Just be aware it's a thing is all. Story 59. I'm just someone who works outside, but the number of people who collapse and get confused in hot weather because they've drunk loads of water and had no salt is ridiculous. Drink water, have a packet of crisps, and refuse to work without breaks in direct sun for too long. Story 60. Cigarettes. I know we say it so much people are just tuning it out, but the number of amputations due to smoking, lose a leg and straight out to smoke after surgery, that they're back 2 years later to get the next leg off. Story 61. Stop touching your face. Eyes, ears, nose, mouth are all easy vectors for viruses and bacteria. Gyms are gross and sweaty. Don't rub your eyeballs in it with your hands. Story 62. Not drinking enough water. It seems like such inconsequential thing, but it's so important. We're 50 to 70 water, and it affects every body system. Some examples of hydration affects include electrolytes, which help control muscle contraction and relaxation, nutrient absorption, and transport like aiding digestion, kidney function, preventing constipation, thermoregulation through sweating, helps keep body systems lubricated like mucous membranes and joints. Its presence in blood helps maintain blood pressure, and dehydration causes blood to become hypercoagulable, etc. Story 63. Snoring is not just a funny sound you make at night. Obstructive sleep apnea can turn your whole life around. Heart failure, heart attack, stroke, high blood pressure, motor vehicle accidents, DT fatigue. The CPAP or BiPAP might look silly, but please don't shorten your life by not getting looked at or by neglecting prescribed treatment. Story 64. Keep a list of your meds and know what they are for. No, it's not on the computer. Meds you haven't taken for 5 years and others prescribed by other doctors will be mixed in. And have a rough idea what they are for. Coming to the hospital with low sugar and not realizing you are on meds for diabetes is ridiculous. Figure out your medical power of attorney now. Talk to your family about dying and at least have an advance directive. I put so many patients on breathing tubes who have multi-organ failure, untreatable stage 4 cancer, and wife kids say we are praying for a miracle while I torture the poor person with feeding tubes, procedures, scans, blood draws and limiting pain meds, and they die anyway in pain. Story 65 Wound care nurse here. Please keep good hygiene and keep an eye on your skin. Also, if your feet are feeling cold swelling in your legs, see a heart doctor for circulation tests. Lotion any sort of dry skin you have before it gets horribly dry and causes more open wounds. If you get calluses, file those down gently and regularly before they get incredibly thick and hard to deal with. Diabetics, please clean and check your feet daily for any open areas. See a podiatrist regularly for routine toenail and foot care. Story 66 Please don't just stop taking your diabetes cardiac psychiatric meds just because you feel fine now. Many of them you will quite possibly need for life. Work with your care team to adjust them. Don't go off doing it solo. Please wash your salad. It's a regular cause of food poisoning. Story 67 Please get your moles checked and wear sunscreen. I promise it won't make you less of a man. I've seen too many people pass from metastatic melanoma. Story 68 Men, if you're experiencing ED or trouble ejaculating, just don't assume it'll suddenly get better. It could be a sign of a medical condition that need treatment. I've known a number of men who were too embarrassed to talk to a doctor about it. I can assure you, they've seen and heard it all. Story 69 Taking non-RX medication haphazardly or constantly. These medications may be readily available, but you really need a doctor's guidance if you're taking as-needed medications multiple times a day every single day. Over-the-counter medications for symptoms like GERD, pain, and allergies can cause liver failure, kidney failure, abnormal electrolyte levels, bleeding ulcers and more if taken regularly without monitoring lab values. Benadryl is even being studied for having a statistical correlation with dementia. Medications shouldn't be used to fix or mask a health issue that can be better treated or cured with different interventions. If you have chronic pain, you can't just take 4 doses of Motrin every day until your kidneys fail. You need to see a doctor. There are very few medications that can be taken for the rest of your life without eventually causing serious side effects. Disclaimer: I'm not saying medications are bad. If you're using them with a doctor's approval with regular labs and checkups, continue taking them as ordered. Story 70 Autoimmune PTS who stop taking meds when they feel better. Looking at you RAPTS on oral meds, you can get out of bed, go walking, get up out of chairs, and dare I say take a bath because of the meds you are prescribed. We know it sucks to have to take meds when you feel fine, but stick with your regimen so we don't have to try to manage pain that is difficult to control. Story 71 Washing your hands doesn't help with airborne illnesses. This isn't entirely people's fault. It's extremely frustrating how much the public health response to COVID emphasized hand-washing sanitizing, when we actually need better indoor ventilation and/or air filtration if we want to reduce transmission of airborne illnesses. Ventilation is super mundane, just open some windows and you're less likely to catch all kinds of viruses. Story 72 I'm not a medical professional, but I saw people talking about dental hygiene and it's so important. I think the problem with me was being told brush your teeth instead of clean your mouth. I would brush but not floss, and never focused on the gums. You need to actually get your toothbrush into the gums. I'm sick a lot less now that I'm on top of my dental hygiene. I drastically changed after expensive dental work and being taught how to clean my whole mouth. I think anyone who can afford a hygienist should go. Mine's only twice a year. Not brushing can cause inflammation and infections, which can raise your chance of cancer, and they are believed to be linked. Story 73 If you have nails, by God, clean under them. Can't remember how often I've seen patients who didn't clean under their nails and then they ask for help and scratch you with their disgusting nails. They pick their teeth with them. Also, brushing your teeth daily. Remember a patient that when I offered him help with brushing his teeth, he said, "Why? I already brushed last week." Story 74 Kratom that they sell at smoke shops is just as if not more addictive than actual weed. And unlike weed, runs you a high risk of seizing out. Stop smoking it. Story 75 I'm a public health researcher, so I study a lot of silly habits that influence your health. Hey, race a list of mundane things to do to stay healthy in order: 1. Stop smoking. 2. Stop drinking, or at least keep it to a maximum of 2 drinks every now and then. 3. Wash your hands, with soap, and not the fancy antimicrobial lotion or whatever. Just get regular old soap. It's fine. Going to the toilet without washing your hands is not just nasty. It's actively making you and people around you sick. 4. Hide exercise in everything you do. Going somewhere, bike or walk, changing floors, take the stairs, desk job, get a small glass so you have to walk to get water every 20 minutes or so. The amount of exercise in your life is quite literally the biggest predictor of health. 5. Small habits add up. Swap 1 cup of coffee for a glass of water, and it won't hurt so much, but it will change your health. Used to eating 2 cookies after work, downgrade to 1 bag of chips each night, half it. You don't have to stop, you just have to be slightly better than before. 6. See a dietitian, even if you're not overweight, a real one. Proper eating habits add years to your life, and it'll surprise you how even the smallest change can influence how you feel. Personally speaking, just adding 1 piece of fruit a day and swapping my lunch to a slightly healthier recipe has made me feel 10 years younger. Additionally, every dollar spent on a dietitian saves 8 in care costs down the road. 7. Find some sports that work for you. Everyone is different, and working out for you might be different than for me. Preferably something that does not feel like a chore and gives you some joy. I personally recommend dancing, easy to keep going for a while, and doesn't feel like going to the gym, and low-effort team games, basketball, football, whatever. Just be sure to not go for the famous third half, only water and healthy foods during and after your exercise. 8. You do not need supplements. This miracle compound will not do anything. There is no one trick that all doctors hate, or I'd be doing it by now. If you eat reasonably healthy, you'll get all the nutrients you need. Unless your own doctor specifically tells you are deficient in something, do not take anything. And if he does, only add that specific vitamin. Multivitamins are useless at best, and downright toxic at worst. 9. Stop listening to idiots online. Find a properly qualified professional that can recommend scientifically reasonable strategies. This doesn't need to be an expensive specialist. Your local dietitian is an expert in healthy living and therapist rolled into one. Story 76 MD here. People over age 50 falling, because their hips and thighs are weak, do at least bodyweight squats, at least twice a week. More weight is better if you can. A broken hip leads to something like a 50% mortality in their first year after going to the hospital. Keep moving and keep your legs and hips strong. Story 77 for young bachelors having only a single dishcloth. The amount of young guys cleaning a kitchen and dishes with a cloth completely covered in bacteria is ridiculous. Oftentimes it's even slimy. This kind of thing contributes to the average cold. Story 78 not getting any exercise. So many issues: pain, excess weight, blood pressure, sleep, back pain, mental health, are improved by getting decent regular exercise. Story 79 not washing their FX King hands from pre-COVID, through COVID, to now, people having a hard time appreciating simple act of a 5 seconds fiction run, be it via alcohol gel or hand sanitizer, or to just washing their hands. So please, TYVM, then they want to shake yours. Yes, wipe one's then pick one's nose. Be really weird to pick someone else's. Not drinking enough water. Archaeologist inspired perhaps. Ask a nephrologist for a lithotripsy excavation near you. Casual consumption. Those who doesn't keep count of the contents and dosage of too much stimulants from a wide range of drinks, from benign coffee to energy drinks, ventricular irritants. Hooray. VTach WA Pulse. I hope, or else stars and the floor guaranteed. Clean hands, stay hydrated, and only consume energy drinks if absolutely necessary. Did I fail to mention extra water after the energy drink? Yup, I did. So water up. Edit. Feel free to wash the rim of one's glass after multiple use. One be surprised how gems stick around, especially after feeling better from a cold. Viral load is a thing. Story 80 not having fluoride in their drinking water. I work in a rural area where a lot of people, including myself, are on well water, and it's surprising how much decay you'll find even though they come to the dentist regularly. I've gotten pretty good at knowing if someone has fluoride in their water or not, or use fluoridated toothpaste, or not, just by the amount of active decay I find. Story 81 underestimating the importance of daily exercise. It doesn't have to be marathon training, just move your body, preferably outside, for 30 minutes a day, enough to get your heart rate up a bit. Build up to 30 if you need to. Physical and mental health depend on it. Physical deconditioning is one of the worst contributors to medical complications. Story 82 not washing your hands. Come on people, this is not elementary school. Yeah, you got a stomach bug because you then grabbed your toothbrush with your poopy hands. Story 83 there is strong evidence that early use of hearing aids for those with hearing issues prevents dementia. There is early evidence that wearing properly fitted dentures also prevents dementia. Story 84 Neosporin. That needs to be prescription only. Most people will become allergic with repeated use. Then of course just keep slathering it on their infected rash that is actually just contact dermatitis. Story 85 massaging an injured site. This is related to fractures. It's a natural tendency to massage painful areas after a fall, right? Well, if a fracture has occurred, blood would pool around the fracture site to form a hematoma. When patients massage it, this hematoma gets dislodged and ends deep inside nearby muscles. The fracture hematomas are rich in fibroblast, which transforms into osteoblast that lays down bone. This is why bone heals in crooked position, even if the fracture is not treated. However, since the hematoma is now in the muscle, ITLL form bone within the muscle, and that affects the muscle function and movement of the area. This condition is called myositis ossificans. Story 86 nurse here. Not sick per se, but lack of mobility over time will slow you down and eventually kill you. We American live a very sedentary lifestyle. If you can't get down on the floor and get up properly in your 30s 40s, it will be impossible to do so in your 60s 70s. Lack of mobility is what causes you not to be able to stand on your own, bend down and pick something up, use a toilet by yourself. So if you want to be able to do those things later in life, you need to be preparing for it in early midlife. Story 87 dental here. Not flossing. Flossing is pretty much the only way to really clean between your teeth, and not cleaning that area will lead to cavities there which will need to be filled or worse. Save yourself an expensive dental expense and just take the extra 5 minutes to floss each night.